Hi, I'm Dr. Nancy Blatt, and today we're going to talk a little bit about insomnia. Insomnia is very prevalent. 5.5 million office visits to the primary care doctor's office are because of complaints of insomnia. So I wanted to first start by defining insomnia according to the medical community. According to the medical community, insomnia is defined as when a patient has trouble falling asleep, or something we call sleep onset, staying asleep, which is considered sleep maintenance, or difficulty with early awakening, which is basically if someone wakes up too early and is unable to fall back asleep. Now, with those symptoms, two other things need to be present in order to make a diagnosis of insomnia. The first thing is that the patient has to have adequate opportunity for sleep. The other thing is that the dysfunction with sleep needs to lead to some type of daytime impairment. So I think that most of us know the symptoms that are associated with insomnia. It can lead to daytime fatigue, irritability, decreased ability to concentrate or make judgments, and an overall decrease in the quality of someone's life. Now, who's affected by insomnia? It increases with age. In one study, elderly individuals, 50% of them complained of insomnia, and only 12% of them complained of having normal sleep. It tends to be, at least in the adult population, more prevalent in women. Adult women are 50% more likely to complain of insomnia than adult men. They've done some surveys in primary care stating that 69% of people complained of insomnia. Now, of that 69%, only 50% of them were just intermittent insomnia, but up to 19% were considered chronic insomnia, which means that they've had symptoms for more than 3 months, at least 3 times a week. So some of the consequences of insomnia are daytime fatigue, difficulty with focus and concentration. As well, it has been linked to an increased risk for accidents, but it's also linked to an increased risk for some medical conditions. There's a lot of research supporting the fact that patients who suffer from insomnia are more likely to develop depression, anxiety, bipolar, substance abuse, and even seasonal affective disorder. It also affects your immune system. So within that, it can lead to more increased risk for infections. It also has a direct link to cardiovascular disease. So what that means is specifically increased risk for hypertension, diabetes, as well as heart attack. There's a couple of biochemical facts regarding patients who are regarding insomnia that I wanted to kind of go over because I think it's sort of interesting. Patients who have good sleep, we actually see improved levels in cortisol as well as glucose. There's a chemical that's secreted from the body called leptin. In patients who are good sleepers, you have a lower level of leptin. And what this leads to is a decreased amount of food craving behaviors. Conversely, patients who are not good sleepers have actually higher levels of glucose. They actually have lower levels of leptin, and it has been specifically associated with an increased risk of carb-seeking behaviors as well as high-calorie food intake. In fact, patients who are not good sleepers or suffer from insomnia, they are 2 times more likely than patients who sleep well to be obese. A couple other things. Poor sleep has actually been linked to cancer, and they've specifically looked at this. In patients who are good sleepers, they have an increased amount of anti-cancer cytokines. What a cytokine is it's basically a substance that's produced by the body to have an effect on a cell. So if you have an increase in anti-cancer cytokines, basically when your body sees an abnormal cell or a cancerous cell, it's actually just going to go ahead and terminate that cell. Unfortunately, patients who are not good sleepers, they actually have just the opposite. They have an increased level of cancer-stimulating cytokines, which means if there's an abnormal cell, the start of some type of cancer, it actually can stimulate the proliferation of those cells. The other thing I want to talk about is brain-derived neurotrophic factor. This is a factor inside the blood that basically helps repair your neuronal tissue. In fact, this is why many times when patients have a traumatic brain injury, we'll actually induce sleep, if you will, to help their brain heal. So there's definitely a reason why we spend 1/3 of our time asleep. It's basically so that your body can repair itself. So it's really important. I did also want to talk a little bit about the fact that it's estimated that actually 60 million people suffer from insomnia, but only about 10% seek treatment. They've done some studies on the indirect cost of insomnia, which has been estimated at about $60 billion annually because of lost wages, sick time, and people being less productive. In the next section, we're going to go ahead and talk about treatment for insomnia, which, contrary to popular belief, is actually behavioral modifications, not taking a pill.